Hey, what's going on, everyone? Dr. Tyler here. We got a great video for you today. I always say my favorite clients are dentists. They're literally like little creatures all day, just doing this basically all day. And they never take care of themselves, but when they do, they come in here and they're really great to work on because they're consistent and they always need help. We got a small business owner today, again, part of the series, so I hope you enjoy. Say some nice stuff about him. Maybe comment on his very good manly looks or something like that, or tell me that I look really tan. I would appreciate that. So yeah, I hope you enjoy. We got a dentist in the house, Dr. Doan. How long have you been in practice?
14 years.
14 years.
Doesn't seem like
We won't guess his age. He looks great. How old are your kids?
1 and 3.
1 and 3.
More like what was it?
Oh, so you just
21 months and 3 years. Yeah.
Okay. Wow. So almost 2. You guys did it pretty quick then.
Back to back.
Yeah.
Everyone was saying, just get it done and over with.
Boys, girls?
1 boy, 1 girl.
Oh, that's perfect.
Yeah.
We have a boy on the way.
Oh, nice.
Yeah.
Congratulations.
Thanks, man.
Everyone will tell you, get your sleep now.
That's what everyone's.
Right?
Everyone keeps telling
and
you that.
And it's so true.
Yeah. So he went back to the gym and did some shoulder press.
Very embarrassing.
When did that happen?
December of 2024.
Yeah, so it's been a decent amount of time. That's like almost a year.
Yeah, almost. And
he was pointing right here, right where your AC joint is. There is a quick little test to, if there's like AC joint sprain, which is like a tear of the ligaments. If you put your left hand on your right shoulder, if that feels sketchy, or if there's like clicking, or it feels unstable, or it hurts, or anything, if it doesn't feel normal, that's like a positive sign that you injured something in your AC joint. It's super easy test to do. He does it perfectly. So either the injury has healed and maybe it's just a little scar tissue, or it wasn't actually the AC joint, and it could be his supraspinatus up here, which is a big ball. Wow. We'll work on it.
You can thank my career for that.
Yeah,
Probably.
Yeah, I've told this story before, but my uncle's a dentist, and he's a pretty like skeptical guy, So when I was going through, I was almost done with chiro school, and he's like, okay, explain to me, like, what is chiro? Like, what do you do? And I had to kind of talk to him in terms that he would understand. Okay. So I was like, okay, imagine your spine is your teeth. What I do is just like kind of like a deep cleaning of your spine.
Yeah.
And he's like, oh, okay. That makes sense.
Okay.
And I was like, yeah, it does.
Yeah, no.
So then that's why my business is called CleanSpine. I'm cleaning your spine, man.
It feels like a deep cleaning.
Yeah, well, this is not the fun part. This is fun for me, not for you though.
It's like a painful burn.
Yep.
But it's like when you work out,
Yep.
That after burn.
Mm-hmm.
Muscles rebuilding, repair.
Yeah. Yeah, we call that copium. Where'd you go to school?
UCSF.
UCSF.
Yeah.
Did you go to undergrad up there?
No. UC Irvine down here. I was born and raised down here, so Orange County.
UC Irvine, man.
Yeah.
I used to work there, actually. Let's bring this up. Good. We'll do a little supraspinatus MRT. Yeah, I used to work there when I was in chiro school.
Oh, nice.
I worked at the student health center. So we would just treat like super depressed PhD candidates. So funny.
Oh, man.
If I wanted to make them laugh or like crawl further into depression, I would say, hey, when are you done? When are you finished? That's like the one thing you can't ask a PhD person, because they're like, I don't know.
They're in school for life.
Yeah. It's like, that's funny because I don't know. Damn. It could be 5 years. It could be 10 years.
When were you there for?
What was I there for?
When?
2018 to 2019.
Okay.
Yeah. It was kind of like we had to get hours, you know.
Yeah.
But UCI was one of the ones that a lot of people wanted to go to. And it was the only one that was like, the only college that was like close. The other ones were like Fullerton, or like there was one in the Valley in LA.
Mm-hmm.
Okay, so you're gonna start like this and slowly bring your arm down and through like that, like you're going aw shucks.
Okay.
And then at the end, pull it farther with the other hand.
Okay. Gotcha.
We're gonna do that a couple times. I'll tell you when to start. Okay, bring it up, down, and around, and then pull it farther. Perfect. Good. Back up, down. Good. Up, down. So have you done that shoulder press since?
No.
Up,
No.
down. Good. Up, down. Good. When I was in chiro school, I've done this a bunch of times, but I injured my back deadlifting. And it wasn't really, I was probably like 90% healed after like everything that I did.
Yeah.
And my buddy was like, well, have you started deadlifting again? And I'm like, what? No. And he was like, well, I was like, why would you want me to? And this is kind of like he's like a PT rehab chiropractor. He's like, well, if you injure the tissue doing this, doesn't it make sense that in order to 100% heal, you have to do this again? And teach those tissue in that vector to, I know you know vectors, in that vector to be strong and adapt again. And I'm like, yeah, it does. So whenever I throw my back out, I literally don't get better until I start deadlifting again. It's weird. It's really crazy. So it's something to think about.
Yeah.
Maybe you can do that motion again, but maybe modify it a little bit.
Okay.
I like standing shoulder press.
Uh-huh.
I think it's just more practical rather than just sitting and, you know, and your shoulders are forward and you're trying to push. Lay on your back, face up. Okay, slide down just a little bit. Let's just go flat hand here. Give me a hug. Leave your head on the table. Perfect. Nice and loose in the shoulder. Perfect. Nice. So we'll just go all through his rotator cuff here. Again, this subscap doesn't feel the best. What are your work hours like?
It's about 8:30 to 6.
Every day?
Monday, Tuesday, Thursday.
Okay.
Wednesdays are my admin days, so it's very flexible whenever I need to go in and take care of stuff.
Yeah, that's kind of how I have it, but I end up just never coming in.
Like last week, I had the electrician come in to fix one of our chairs. Just random behind the scenes stuff that no one really ever gets to see.
Yeah.
And then Friday is 7:30 to 2. So it's a short day.
Damn, you work every day. No Saturdays?
No Saturdays. So.
Okay, let's check rotation. So when I bring it here, it stops rotating, and then your shoulder goes up.
Yeah.
So that could be a spot that we want to work on. We'll do a little PIR. Start here. So I want you to bring your arm back into me like that.
Okay.
Like 20% of your max force, okay? Go ahead.
20%.
Yep, perfect. Now take a big breath in. Hold your breath. Now relax, breathe out. And breathe normal. So every time we do that, should be able to go a little farther. All right, push up into me. Breathe in. Hold. And relax, breathe out. Look at that, that's good. All right, push up into me, breathe in, hold. Let's kind of like a super stretch. And relax, breathe out. Still coming up a little bit there, but pretty good. Nice. Does it hurt when you sleep on it?
Sometimes, yeah.
Okay. Does it ever pop and click?
No.
Okay.
Not that I could recall.
Okay.
Actually, no. Sometimes, but I'm not sure which shoulder it is that pops.
Okay.
That analogy of the deep cleaning is, yeah, that really hits the spot there.
You know what I mean?
I totally get it. Like,
yeah.
All my patients hate deep cleaning.
Yeah.
You know.
Yeah. And the way I have it set up here, my goal is to get people to come back like one to 4 times a year. So it's like, just, you know, come in, get your spine cleaned out, and then be on your way. Yeah, I hate getting my teeth cleaned. Because it's my uncle too, and I already know he knows all the answers to his questions. He's like, "Have you been flossing?" And like, I know he knows that I haven't been. You know, I know he knows.
We know.
Yeah,
it's true.
And I just like try to say, "Oh yeah, you know, I've been doing like the water one, and you know, yeah."
We just want to know if you're telling the truth.
Yeah, I know. I just feel so embarrassed. Like, oh, I was on a good streak, and then I just stopped. I'm sorry.
I feel like your patients, they must look forward coming in to being adjusted.
Yeah, some, you know, I get in there, you know.
Yeah.
It doesn't necessarily feel good when I'm working on you all the time. And some people are still scared of the cracks, you know.
I think I'm more addicted to the cracks.
Yeah, dentists are the worst, bro. You guys are like lifelong chiro patients for sure.
Oh, yeah.
You're just like crawled up into a pretzel when you're working all day.
Yeah.
Let's check right here. Okay, bring that there. Let's just do some mobilization. Kind of like for the students, this is the J move. Okay, let's go face down. Let me get you a face paper.
My patients are more like, "We love you, Dr. David, but we just hate being here."
Yeah, yeah.
Like, I hear this 10 times a day.
Yeah. At least they're honest.
Yeah. Face down.
Yeah, let me grab the mic. Do you get headaches?
I used to get a lot more headaches, like migraines and stuff like that.
Oh. Do you still?
Well, just, every once in a while.
Okay.
But it's very, I would say it's more like once in a while, maybe my wife thinks maybe when my blood pressure is up or when things are like stressful or something.
Okay.
But, and I just.
What does your wife do?
She's a pharmacist.
Oh,
Yeah.
nice.
Yeah.
But did you have the migraines like when you were younger too?
Yeah, I've always had them for a while. But my blood pressure has always been good.
If you've had it for a while, I don't know if it's blood pressure related. It's hard to say. Could be genetically predisposed to it though, if it runs in the family.
And then every now and then when it happens, then just take a Tylenol or Motrin and then it.
Just take some drugs, man.
Yeah.
Love drugs.
Which is so funny because my wife's a pharmacist, but she will not take anything. She's more like natural immunity.
That's awesome.
Yeah.
That's like my mom.
Her immune system is like, I'm very jealous.
Yeah. Just never get sick.
Yeah. Oh, up until we had kids though. Then you get sick all the time.
I keep hearing that. Yeah. You feel the headaches in the front usually?
Yeah, more in the front.
Okay.
I think around the temple area, but
yeah.
sometimes when I get it really bad and my wife helps me out by massaging my head just to help relieve some of that tension, she'll go back to that occipital area,
Mm-hmm.
and then put that pressure underneath it.
Nice.
It's like our head's like a bowling ball, right?
Mm-hmm.
It's just compressing our spine.
Mm-hmm.
So she kind of helps like lift it up a little bit to release some of that pressure.
Dang. Yeah, that's exactly what I would do. Sometimes you can get in the sutures too here. Just break up the tissue a little bit.
Did you also like specialize in like sports, like a sports chiro, or I
You know,
if there's such a thing,
I wanted to, but when you start in that world, you realize that it's a bunch of dick sucking, bro.
Yeah.
Like, let's be real, and maybe they'll give you a chance. And there's only one on each team, you know, and it's just like not worth it. You have to wait for someone to either like retire or get fired or something. And they're all just like so just obsessed with evidence. And I'm just like, I don't know. I don't like it. It's not my cup of tea. I shadowed the Angels chiropractor, and he was saying like, it's really stressful, man. He said he popped Josh Hamilton's. He was a baseball player. He popped his ankle before a game, and then he went home, and then the head trainer was like, "What the hell did you do to his foot?" Like he was having like a sore foot before the game. He's like, "Get over here and fix it now." And then he was like, "Oh shit, what do I do?" And you rarely like adjust them. It's mostly just like soft tissue stuff like this. So I wanted to make people feel better, you know? I didn't want to like rise the ranks my whole life to maybe get a shot at a pro team. But I like to learn about rehab and stuff like that, so I can give people some knowledge. That's good in there.
Yeah, I've had my fair share of visiting chiro offices and stuff, but I've never had the stuff that you're doing, which is amazing.
Yeah, because it's hard.
I've never experienced anything like this.
Yep, I kind of changed the game. You know the 15 session thing you were talking about. Like, who comes up with those numbers, man?
Yeah.
Like, I would always see that, and then I found out for chiropractors, you hear about like the treatment plans and all that stuff. There was a book. Somebody wrote a book about how to do treatment plans for as a chiropractor, and I'm just like, you learned all this from a book? Like, really? That's no. I don't like that. First rib there. So yeah, I just want people to come and go as they please, but they also come in and they pay for a certain amount of time. So new patients, you know, you get 30 minutes with me, and I work on you for 30 minutes. You know, a lot of chiro offices, it's kind of just, you pay for the adjustment, not so much the time. So sometimes you're in and out, sometimes you're there for a while if they're slow. That's a good spot.
Do you work with like a physical therapist or a...
I used to, yeah, we have a massage therapist here. I used to have a physical therapist renting a space from me. She did pelvic floor PT, so she worked with a lot of like postpartum or pregnant women.
Oh, nice.
Yeah, that was cool to see. Good. But like, I send people to PT for sure. That's probably what I would recommend for you. Shockwave is great. you'll probably stop at like 90%. You'll never get that last 10% unless you start training it. And you can do that yourself, or you can just pay a physical therapist to help you do it. He's got like L1. T12, L1 here. So we'll do that A to P. Flip over for me.
Okay.
Lift your head up. Keep the chin down for me. I'm going to pick you up. Don't help me at all. So T12. Yeah, that doesn't move. We're going to have to get that in side posture. That's an interesting one. Okay. Don't see T12 stuck like that too often. So she kind of does something like this.
Yeah, and like more like at the base of the skull. There, yeah, and just push it like almost like acupressure or pressure points or something.
Yeah, that's awesome.
Yeah,
it's hard to do. That's impressive.
no, it's just whenever we're having like a long day or we both need it, then we'll do it to each other. You know, we'll lie in bed and then I'll lie in her lap and then she'll lie in my lap.
Nice. Got this. How's your jaw?
That was okay.
No issues with it?
No.
Let's see. Good.
Oh, funny story though. I have patients with like TMJ
Always.
all the time, and then I remember one. Usually our referrals are to like either oral surgeon or a TMJ specialist.
Yeah.
Yeah. And then one time, this one patient was like, "Oh, I didn't go to the referral you gave me, but I went to the chiropractor just down the street who, when I was doing my manipulations and whatnot, he asked me if I had TMJ, and I said yes. And he was like, "Oh, let me take a look at that." And then he did some massaging, he did some manipulations there, and since then I don't have issues with my TMJ anymore. I was like, "Wow,
Yeah.
you guys have some."
I work on it
secret
all the
powers.
time. Jaws are weird though. I'm sure you know.
Yeah.
One person you treat, one visit.
Uh-huh.
Oh my God, they tell everyone, man. They tell everyone, and then other people. Who knows?
Yeah,
their jaw is like they open it pops like 5 times. The worst is when you have them hold their jaw open and it's wiggling. Like they have no control of their jaw.
Yeah.
And I'm just like, what happened here? So we're gonna set up T12 L1, not a pull, not a long lever. We want to get right in on the joint and smack it L to M for the students. That should be good. So I'm just working on getting a good grip here. Check out where I want to drop. Beautiful. Okay, on your back, face up. Yeah. Hips are good. 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 Go ahead and stand up for me. And then just do one of these with your left. Yeah. And just push your elbow back into me. Good. Yeah, sometimes I'll pop a little bit there. Have you seen that Y-strap thing I do?
Yeah, the neck thing?
Yeah.
Yeah.
What are your thoughts on that?
I'm game.
Yeah. I think you're going to like it. If you like distraction on your neck, you're going to love the Y-strap. Go ahead and lay on your back, face up over here.
I see your videos. I know how it gets everybody.
Yeah? You know all my tricks?
You distract them for a little bit.
No, I don't do any of that, bro. What are you talking about? Slide down a little bit? Yeah, it sucks when people come in, they know all my tricks. The best is when there's people that come in, they're like, what? What is the Y-strap? I'm like, oh, yes. Yeah, so I'm just going to stretch you out first, see if we both like it. If we both like it, I'm going to give you a quick little pull. Nothing crazy. Lift your head up. Down.
Because when I go in, they put me on these machines to...
yeah, like a decompression machine.
Yeah, decompression machines, yeah. One straps in my head, and then it lifts up. And then...
yeah, nice.
The other one straps my lower hip, and then it pulls my hip down.
Does that feel okay on the cheeks?
Uh-huh.
Okay. Let me know when it starts to feel like a nice stretch in your neck.
Oh, yeah.
Nice.
I think I heard like 2 or 3.
That's it?
2 or 3. Yeah, that's pretty good. I went like deep into the spine.
Yeah, it's nice. Yeah. I'm excited to see how you like that.
Oh, wow. God, like, the pressure points like really well.
Yeah. That's why I really like the muscle work aspect of like treating people, you know? And I'm really good at memorizing patterns. So I've memorized what a normal spine, normal body is supposed to feel like. So, you know, putting my hands on you plus what you tell me, I'm just like, yeah, I feel that. I get a little concerned when I don't feel anything. And they're like, yeah, I have so much pain right here in my neck. And I'm like, yeah, there's nothing there. That's not good, you know? Or if things don't crack or, you know, they don't get better after even just one visit, that's when you know. Because usually it's like, yeah, you're good. You'll feel better, 100%, if it's normal stuff. But I don't do imaging right off the bat because most of the stuff is just like, if you're doing x-rays, you're just looking for arthritis. And you can tell if there's arthritis in there already. There's stiffening. They'll say like, yeah, my back hurts when I wake up in the morning, and when it's cold, it's even worse. But when I get going, it feels better. That's literally arthritis. I don't know why you have to take x-rays just to prove to yourself that it's arthritis. But so your jaw popped. It feels a little loose. I wouldn't be surprised if that has something to do with like the tension up here. You could work on jaw strengthening stuff if you want. A good one is putting your tongue on the top of your mouth and then trying to open your mouth. It kind of like keeps things stable while trying to open it. It's called end range loading. That's a pretty good one that I've heard helps with people. And I think when that tension builds up, that's probably when you get the headaches. So maybe a little clenching at night too. Yeah, it was a little. Even when you talk, you kind of talk like this. Like one side, it doesn't open at rest as well subconsciously. You don't notice that. So that's why I adjusted it. But yeah, with the shoulder, I released everything. Test it out at the gym if you want this week. Something that's really, really good for front of the shoulder stability is dips. So like for you, if you went and did a dip, if it hurts really bad, don't do it again. Okay. But it should feel good. It should be like, oh, that feels nice.
How deep should I go?
Not super deep. I would go to like 90 degrees here and then come up. Okay. I mean, just play around with it, but like, I don't know. I have a torn labrum and it feels really good to do dips because the front of my shoulder is torn. So creating stability there, it feels good. But if I go past a certain point, I feel like it's gonna snap when I come up. So just play around with it. It should never hurt.
Did you notice anything about my right arm by any chance? Anything different off or compared to the left arm?
I didn't really. Why? What's going on?
There's nothing. Just wondering if you can tell if there's anything off or different.
Is this a test?
Yeah, it's a test.
It's a test, huh? Right arm or right shoulder?
Right shoulder.
We have this. Does it pop, click?
About, let's see, 13 years ago, I dislocated it in a snowboarding accident. I was racing my roommate down the hill.
Well, I could feel this in here. Did you get it repaired?
It was a mild anterior dislocation.
Okay.
They popped it in at the ski resort.
Okay.
And then, I knew that the range of motion was never the same, but that was like years ago. Now I don't even think about it. But I know when, like, on my back, if I tried to put my thumb right underneath it, it's like, this is as far as I can go. So I noticed that. I noticed that.
Here, this is the labrum side.
Okay.
Yeah,
So,
I've already accepted it,
Okay.
and it hurts when I try.
Okay.
Didn't notice too much. No, it feels pretty good. You have like a spot of like inflammation right in here that I don't feel on the other side, but you know, it's probably just compensation.
Yeah.
How quick did they pop it back in?
Oh, probably within an hour.
Yeah, that's awesome.
Yeah, but I remember, like, I was looking at my hand, my arm, and I was like, I can't move it.
Yeah.
And I was like, and my life was, this was during residency.
Yeah.
And I was
My
I was like
God.
after dental school, 4 years.
Yeah.
Halfway through residency, I'm like, my career flashing before my eyes.
Yeah.
You know?
I've been so jealous of people that go snowboarding and have a great time, because I avoid it.
Yeah.
I broke my thumb when I was in Chiro school.
Okay.
Playing flag football, and after that I swore to myself I'll never put my hands at risk again.
Yeah.
So all my friends are like, dude, we're going snowboarding. Like, I'm like, have fun. Yeah, I know I'll do something stupid, you know, I'm gonna like fall and like land on my hand or something. Yeah, so that complicates things with the dips. Like I said, if you're doing dips and there's sharp pain in your shoulder, stop doing it. Or you
can
can
more less of an angle.
Maybe, just play around with it. Yeah, dislocation literally means like the structures that hold it together ripped apart. Yeah. You know, your body patches it up with scar tissue, but it's like a glue machine. It goes like so the scar tissue doesn't just like, it's not perfect, you know. So that sharp pain, that would be the scar tissue like stretching, and you wouldn't really want to inflame that. Yeah. All right, good job.
Thank you, sir.
Of course.
Thank you.
Hey everyone, if you made it this far, I just want to say thanks for watching, thanks for supporting. If you can, like, subscribe, comment down below whatever you liked about the video, or if you have any questions. And yeah, hope you have a great day.